Hi, my name is Ken Ike. I work for the Michigan Vascular Center here in Flint, Michigan. I'm a certified prosthetist and working in conjunction with amputee associates to bring everyone a few instructional videos on things regarding their prosthesis. Today we're going to talk about the suspension sleeve. The suspension sleeve is a critical part of the prosthesis because it helps to hold it on. If it's not working properly, the prosthesis moves up and down excessively, cause blistering and sores and things like that. So it's really important to make sure you have a good one. There are also things that wear out fairly quickly. It's not uncommon for a patient to go through a suspension sleeve every 1 to 2 months. So they are things that need to be changed. Typically in my clinic, I like to invite patients in. When they need a new suspension sleeve, they'll bring their extra one in to me. It gives me a chance to take a look at the overall fit of the prosthesis, other things that might be wearing out, but there may be those occasions where you need to change it at home. So what we're going to do today is talk about how you do that. The first thing you're going to do is take your old suspension sleeve off. So basically, you grab it from the bottom and just simply lift it up, and the suspension sleeve comes off. Sometimes you really don't know when the suspension sleeve has gone bad. Many times they'll stretch out at the top, which makes it loose and allows it to move up and down. But this one, you can see when you turn it inside out, this one actually had a hole in it. You wouldn't think a hole like that makes much of a difference, but the suspension sleeve works on two principles. Number one, when it comes up onto your leg, it basically grabs a hold of it and that holds it on. The second principle would be suction, and a little hole like that can allow air in and out of the socket and allow that excessive movement and create problems in the prosthesis. So if you're feeling excessive movement in the prosthesis, likely the sleeve needs to be changed. So putting the sleeve on, wouldn't think like it would be a very big deal, but it can be very, very difficult. Most of the time patients will, or clinicians even sometimes, will just take the sleeve and try to pull it over top, but it's so sticky and so grippy that it will not slide down. It makes it very difficult. So we're going to show you an easy technique today. The first thing you're going to want to do though is before you take the sleeve off, you need to evaluate what it looks like. There's a couple things you need to check. The first thing is, what's the front and back? There's a bunch of different types of sleeves out there. We have a brown one here that really, there's no lettering on it or no seams or anything. So this one can actually go any direction that you want. This particular sleeve is actually designed with a knee. The knee is located in the anterior or the front. So we need to make sure that when this sleeve is put on, that it goes in the front. So take a look at the way the sleeve is applied. If there's lettering on the sleeve or if there's a seam, just make sure it goes back in the same spot. The second thing you're going to want to look at is how far down on the prosthesis the sleeve comes. Some sleeves will come farther down on the socket, other sleeves will just barely come over the trim lines. So you'll want to take a look at yours and make sure that the next one ends up in a similar location. The height of the sleeve on your thigh is critical. If the sleeve is too far down and there's only a couple inches on your thigh, that sleeve is going to be more apt to move up and down. By the same token, if the sleeve comes up too high on your thigh, sometimes it gets excessively tight and can cause blistering or something like that. So take a look at the way the old one is on and try to make it so the new one goes in a similar fashion. So again, we just grab it at the bottom, pull it up, the old one is taken off. When we go to apply the new one, I like putting the prosthesis on the ground. Now this would be if someone is helping you replace the sleeve. Obviously if your prosthesis is off, you as an amputee, you wouldn't be able to stand here and do this. So first I'm going to demonstrate if someone is assisting you at home, and then I'll demonstrate if you are having to change the sleeve yourself. So we take the suspension sleeve, I make sure that I get the front oriented where I want. Okay, it's pointing up just like this. Now what I do is I invert the sleeve about 1/3 of the way up or to where the knee is going to be located. So we take a look at where the knee is. Then I just place it over top of the ears of the socket, just like this. Grab the part that was inverted and simply bring it down. And your sleeve is in position. Okay? If you have to, you look around, make sure it's straight. If there's one area that happens to be up a little bit too far, you can simply grab that and pull it down a little bit, make those adjustments. But basically, the suspension sleeve is perfectly in place. Again, to take it off, you just do this. Make sure you get the front. Oh, also, the bottom of the sleeve is typically going to be narrower than the top. If your sleeve, this one is perfectly cylindrical, so it could probably go either direction. But most sleeves are designed so they're slightly smaller at the bottom. So take that narrow part, which is the bottom, find the anterior or the front, invert it slightly, put it over the ears of the socket, gently like that, grab the top that's inverted, and bring it down into position. Okay? We can also do this from a seated position, just like this. Take it off, invert the sleeve, put it over the top of the prosthesis, slide it down into position. There are several different types of sleeves out there. Some are made out of urethane, some are made out of silicone, some are brown, some are black. Your clinician has likely chosen the one that they feel is most appropriate for you. There are some that are more elastic, that are easier to put on. There are some that are much more rigid, that are more durable. So again, if you're having issues with your sleeve, simply call your clinician and they can maybe suggest a different type if there's a problem. Also, because you're doing this at home, if you've used the last sleeve that you have at home, it's really important to give the prosthetist a call and make sure that they either order you another one so you have a spare, or maybe you might also qualify for more supplies like liners or socks or something like that. So the interaction with a clinician is really what makes the difference between a successful prosthetic wearer and someone who's not so successful. So just because you're making these changes at home, make sure you let your clinician know about the different things that you're doing. So good luck with the exchange, and look forward to coming back with another topic for you.